the initial reason or the initial idea to design a new stem was the feeling that we are not at the end with our stems that are available today. We all know that the stems today works quite well. They have very, very good survival rates. We are coming close to 95% after 20 years. But there's always, every stem, every design has some disadvantages. And the main disadvantage is operation technique is sometimes quite difficult. Some stems have a higher periprosthetic or intraoperative fracture rate. Some stems have a higher rate of malpositioning in the femur, and so on and so on. And then we had the idea to combine advantages of different designs and to find a solution, that means a new design which combines all the advantages that all the different stems has. We started in 2008. 2008 was a quite long planning period. So we were sitting together, we analyzed what designs we have on the market, which designs are really successful, what is the most easiest design regarding the implantation technique, and so on and so on. And that needs a long time. And then we started with some models, and we discussed the models with the engineers, with the mechanics of the factory. We discussed it, we looked after the literature, and so on and so on. We modified it many, many times, and at the end we had the first trials. And that needed, I would say, in total, only this planning phase needed almost 3 years. In our eyes, and in my opinion, the anatomically shaped stem has two main advantages in comparison to all other, especially the straight stems. And this advantage means that the anatomically shaped stem is following the shape of the proximal femur, and that means that you can implant it without touching the greater trochanter. And we all know the situation when we try to position a straight stem into the femur, that we have to work into the greater trochanter, and sometimes we harm the gluteus medius. And this is a problem, because we all know that the gluteus medius is the most important muscle. I call it always the motor of the hip. It is the main stabilizer of the pelvis, and this is for me the biggest advantage. The second advantage, which has something to do with, the positioning of the stem into the femur, and which has a lot to do with avoidance of malpositioning, is that an anatomically shaped stem is, I would call it, self-centralizing. That means it centralizes itself into the femur. For the surgeons, this is my experience of the first, I would say, almost 100 stems that I have done now during the last 6 months. This is my personal experience, is that the operation technique is much more simple, and much more easier means quicker, safer, and easier. Especially for the young surgeon, The surgeon, okay, he always have to know what he is doing, but I would say the malpositioning rate, especially when the young surgeons are starting, and the intraoperative or even periprosthetic fracture rate is lower, also for young surgeons. The anchoring of the bone, and this is, at this moment, it's a little bit theory, of course, because we have no long-term data. But the theory is that the main advantage regarding the anchoring of the stem into the bone is the better rotational stability. And this is my hope, that we, due to this fact that the rotational stability is better, lower loosening rates and better survival rates. Yeah, for the clinic, for the hospitals, it has also many advantages from my point of view, which are explainable with all the advantages that the prosthesis has. If you have a lower fracture rate, if you have a quicker surgery time, if you have more safety, if you have a better stabilization into the bone, then of course the revision rate is declining, and this leads to the fact that his hospital is getting a better reputation, higher reputation, and it has not to pay for all the expensive revisions. I started with the SBCL 6-7 months ago, and I did almost 100 cases now. And to be honest, I'm a little bit surprised, and that means I'm positive surprised. I was really not sure that the implantation technique is so simple, is so bone and tissue preserving and sparing, that I never experienced before with any other stem.